attorney's fees to try.
Hello, Colby.
There he is.
Just made it. Kevin, you want to tell him what I told you? Thank you. All right, good evening, everybody. Today is Wednesday, July 24th. Time is 6:30 p.m., and I am calling this meeting of the Macomb Township Board of Trustees to order, and we will now say the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Clerk Posey, will you please call the roll?
Trustee Cusimano.
Here.
Trustee Lucido.
Here.
Trustee Oliver.
Here.
Trustee Nevers.
Present.
Treasurer Drollet.
Here.
Clerk Posey here. Supervisor Viviano.
Here.
All members are present.
Moving on to approval of the agenda. I am requesting that we amend the agenda to remove item 8, to take what is now currently item 9, which will be the presentation from MedStar, make that item 8, and then introduce a new business item that will be item 9, which will be a budget amendment. You know, that was kind of a lot, but I went over it with the clerk's office before this.
Motion to approve with the proposed adjustments and amendments.
Support.
Any questions or discussion? Motion by Treasurer Gillette, supported by Trustee Lucido, to approve the agenda as corrected. Members, please vote.
Did it work?
We hope so.
Just takes a second.
There it
Give it a
is.
second to pop up. Motion passes unanimously.
Great.
Moving on to approval of the bills. Is there a motion?
Motion to approve.
Support.
Are there any questions or discussions on the bill run? Hearing none, motion by Treasurer Gillette, supported by Trustee Nevers, to approve the bills. Members, please vote. Motion passes unanimously. Item 4, approval of the previous meeting's minutes from July 10th, 2024, and the closed session meeting minutes from June 12th, 2024. Is there a motion to approve?
Trustee Kuzma makes the motion to approve.
Support.
Any discussion? Motion by Trustee Kuzmano, supported by Treasurer Gillette, to approve the previous meeting's minutes from July 10th in the closed session from June 12th. Members, please vote. Motion passes unanimously. This will take us to our first public comment. This is on agenda items only. If anyone wishes to make public comment on an agenda item, please make your way to the microphone on the right-hand side of the room. I don't see anyone present who wants to make public comment, so we will move on to the consent agenda.
Motion to approve the consent agenda in its entirety.
Support.
Any questions or discussion on the consent items? Hearing none, motion by Treasurer Gillette, supported by Clerk Posey, to approve the consent agenda. Members, please vote. Motion passes unanimously. All right, this will take us to our presentation. First off, I have to apologize. Our normal projector is not working, so we are using this temporary one that has been partially blocking everybody's view. And it is just warming up now, so Mr. Colby Miller from MedStar, the floor is yours.
Thank you. Thank you for having me tonight. I have in front of you our 2023 annual report. We're a little delayed in presentation. We've had 2, maybe 3 CAD upgrades at the start of the year, and during all of our CAD upgrades, we're told to stay out of our data from a reporting perspective. So now that that's stabilized, we can get to presenting. Same format you've seen before. The reasons for request, top 15 reasons for requests in the township in the year. Sick person, difficulty breathing, falls, and traffic accidents lead the pack. There are more reasons, but they get down into some pretty small numbers. So you can see in front of you what the 911 requests are in the community for the year. There is an unknown medical component. That's where either the dispatcher can't give it a categorization from the information the caller is providing, or the caller is unfamiliar with what's happening at the scene. Someone told them to call an ambulance and they just don't know how to answer the question. If there's any questions about the data as I move through it, please stop me. I think we've seen it before, but I want to make sure I'm covering everything for you. From a response mode, as most of you know, we're working with the National EMS Quality Assurance Group to lower emergency responses across the country and really start to analyze the impact of response times on patient outcomes and present clinical information rather than how the request gets better as we get better at asking questions of the 911 callers. For a total, by the way, of 6,320 responses in the township. This is where things get interesting. 5.5% of your patients are transported to the hospital emergency status. So of the 6,320, 350 of them go to the hospital. And our definition of emergency transport is lights and sirens. So that's a critical condition for the patient, happening a little less than one time a day. 3,600 are transported non-emergency, and then the rest of the responses are canceled for one reason or another. Canceled en route, canceled on scene, the patient doesn't want to go. No one told you to call an ambulance for me. Any number of reasons were canceled on scene. Some of them are lift assists. Some of them are somebody called an ambulance for somebody who they thought needed one and they didn't. And then there's the canceled en route where the call comes in, usually from a cell phone for a motor vehicle accident. By the time the first vehicle gets on scene, it turns out there's nobody injured and we're canceled before we arrive. From an emergency response time performance perspective, our contract is 90%, our fractile compliance for the year, almost 95%. Average emergency response time of 5.6 minutes, 5.06, that's 6/10, not 6 seconds, just to be clear. But well within the contracted numbers, and there's very few outliers in there, but again, this is a full year report, so we have weather to deal with, we have second requests, a number of things that occasionally lead to a long response time. Also during the year, we had 5 mutual aid requests. We turned over 5 requests in the township to another provider. Their ambulance is closer than ours, second ambulance on scene, any number of reasons for mutual aid, but 5 mutual aid requests of 6,320 is a pretty safe number for us. Non-emergency response time isn't a heck of a lot longer than the emergency requests, averaging about 6.45 or 6 minutes, 45 seconds. Still bunched up, far less than 12 minutes. Obviously, a couple outliers there too. That again, we do track second responses to the same scene. So if there's an ambulance on a motor vehicle scene and we request the second or third truck, they generally come non-emergency status. That runs up some of those response times. So in some of the non-emergency response times, remember you're seeing second and third trucks on scene. In 2023, we began a project, and this has got a lot to do with our data upgrade. We're participating now, we're the only Michigan EMS agency participating in the National EMS Quality Alliance. This is a federal initiative to bring EMS stakeholders, national EMS organizations, healthcare stakeholders, EMS unions, any stakeholder organization with an EMS interest across the country has come together to form this alliance. Again, brought together by the federal government. There are several EMS agencies in the country. MedStar is the only one in Michigan. But instead of looking at response data, now we're looking at national data about patient outcomes, what clinical care, what delivery systems, what tools, what techniques moves the needle on patient outcome from a clinical scoring perspective, rather than, again, this race to the scene that we've all been used to since 1978. So we're happy to be a part of this. It's pretty amazing data, seeing it come together across the country. It's nice to be able to benchmark ourselves against quality providers from around the country. I've included one chart in here from the end of the year just to see the level of granularity that we get on all of our clinical scoring stuff. I'm sorry, move this thing forward here for you. But as we look at the care that we deliver compared across the national benchmark, in my next report, rather than, although we'll still include response times, we're going to be looking at the clinical care that we deliver in the bundles of clinical presentations that our patients show. specifically stroke, STEMI, trauma, and sepsis. Those are the hot button clinical issues for the healthcare system in the country right now. And this data lets us look at the care that we deliver and how it affects the patient outcome downstream. Currently, all of our bundles are 95% or better, comparing ourselves to the national benchmark. And again, first agency in Michigan participating. So we're pretty excited to be able to present that information to all of our stakeholder communities. We continue to participate in the EMS survey team, National Patient Satisfaction Survey. The surveys are mailed, still a paper mail survey. It goes to almost all patients who are served in the township. There are a few exclusions. Anybody incarcerated, anybody restrained, anybody with a behavioral health reason for dispatch, we exclude them from surveys. We try to catch multiple patients so that we can match up the survey data on the back end with which request it was. Sometimes a little difficult, but nonetheless, patients going to just about all, or surveys going to just about all of your patients. 97% top box satisfaction from Macomb Township patients. Top box satisfaction, I always make sure I clarify with everybody, that is the summary of all the positive responses. So the survey has 3 levels of satisfied, satisfied, very satisfied, and extremely satisfied. We roll those up into positive responses and call that the top box outcome. 97% in the township. Provided you with 5 of the highest response categories. I don't want to read the slides to you, but the degree to which the team took the problem seriously, we think that's an important engagement perspective for the patient, that they understand that our crews are listening to what they're telling them and not kind of blowing them off on some of their complaints and actually paying attention to what they're saying. The care showed by the paramedics, the extent to which they cared for you as a person. We think that some of the compassion scores in this are pretty important. Clinical care, we know, we monitor our clinical care. The survey data that we get from our patients about how we treated them as individuals is equally important to us. The timeliness of the ambulance arrival and the overall skill of the paramedics, all rated in the top categories from the Macomb Township residents. Included a couple of quotes from the surveys. I share these once in a while when they come in, but there's 5 here. We get hundreds of them. But it's good to see, again, that the feedback from the patients shows compassion, caring, professionalism. Obviously, the patients are having a difficult time during these responses. We place a lot of value on this feedback from the patients, and we share it with the personnel, and whenever we can, we share it publicly and recognize our providers. We did receive 2 complaints from the township during the year. One was a family member who was upset that that it was an indirect complaint. Calling on behalf of the patient, they were upset that their patient was not transported to the hospital of choice. We overrode the patient's decision and took them to a closer hospital because of their condition. And upon arrival at the hospital, the patient skipped the ER and went straight to the cath lab. So again, the decision to transport to the hospital was the right decision. It just wasn't well received by the family members. There was a second complaint about a child on a scene not permitted to ride in an ambulance without a car seat. When a car seat's been damaged in a motor vehicle accident, it can't be used to transport anybody. There were family members on the scene. We suggested that they take the patient to the child, and again, in retrospect, did the right thing. Generated a complaint, but for the right reasons.
Mr. Chairman, are we allowed to ask questions during the presentation?
I think he's got a slot for that at the end, if you wouldn't mind holding it.
Just real quick, is it out of the 6320 total, there's only 2 complaints?
Yes, sir.
Thank you, sir.
Now, there is, I will say, those are 2 specific complaints received at the office. In the patient satisfaction survey, every now and then there will be a low score, but unless there's something specific written in the low score, we don't register that as a complaint. I will also tell you that one of the downsides of the patient satisfaction survey, it's a 1 to 5 Likert scale, and every now and then you get a survey back, and if it's below a certain level, the survey company sends it to us for specific review. You'll get a survey back where they've marked all 1s, which is the lowest score possible. And in all the comment categories, it'll say, great job, your team was wonderful, excellent care, thank you for serving me. They're just not following the survey right. But from specific complaints, there were 2. MedStar activities during the year that directly affect the township as well as organizationally. We continued on our CAD upgrades in both of our dispatch centers. We now receive all of our emergency calls direct from Comtech. They show up directly in our CAD. No more transposing address numbers or picking, we had some matching street names that were affecting us with other municipalities. That's gone now. Even the time it takes to put the call in, the calls, as soon as Comtech puts it in, it's in our CAD. The Shock and Save CPR and AED initiative continues. 2 golf outings last year. I think most of you are aware, we raise money for AED contributions, and then we match every dollar raised with AEDs and CPR training in the communities we serve. We held our second annual EMS Safety and Design Summit in Detroit. We'll talk about that in a minute. Our paramedic programs graduated 19 new licensed paramedics. We have 33 graduating this year. We're pretty proud of that. 78 new graduates in our EMT academies. Those are paid full-time academies. And we invested about $2.5 million in new clinical fleet and safety equipment. The work with NEMSPA and the EMS System and Design Safety Summit that we held last year, going to be held again this year, this time at the Michigan Central Train Depot in Detroit. But we continue to work with some national stakeholders. I've included the organizations that are involved in these efforts on the slide, continuing to work on reducing red light and siren emergency responses, and a couple of months ago released a joint position statement for communities and healthcare stakeholders to begin to benchmark and use data from EMS services and systems that reflect the clinical care and the outcome impact that clinical providers have in their communities. Again, reducing the risk of the red lights and siren responses and helping our stakeholders understand the real clinical measures that should be driving EMS system performance. We completed our reaccreditation in 2023. We received our 6th consecutive reaccreditation with a 0 defect score. We think we are one of 2 organizations in the country that have had what will be now 18 years of 0 defect accreditation. And our education program went through its reaccreditation in 2023. We did not get the full accreditation stamp back yet because the full panel has not met, but the on-site survey team left with no follow-up items and no request for additional information. So we believe that'll be another full reaccreditation of the education program. With that, happy to take any questions.
Thank you, Mr. Miller. I have one question. You think you touched on this throughout your presentation, but if you could, what are your, I guess, top 2 or 3 areas where you think MedStar can make improvements, and what are your plans to make those improvements?
We continue to try to get the right resource to the right patient at the right time. So as we look system-wide, we look at utilization of ALS versus BLS. For example, we know that there are about 5% of our responses where response time from national data has an impact. And of that 5%, there's about half of those patients where clinical care delivery, actually, skill improvement for the paramedics, expanding the simulation lab, reducing our clinical critical incidents internally, and then faster data management back out to our communities. For all the CAD upgrades that we made in 2022 into 2023 and 2024, mid-year this year, we decided to scratch it all and buy a whole new CAD because it will provide better feedback, real-time feedback to our communities and our healthcare stakeholders so that we're not having to go in and produce manual reports all the time, and people like yourself can just dial in and see exactly what's happening. That real-time data helps us in reducing safety, risk issues, it improves clinical care, and it lets our contracted communities have a better look at what we're doing. The other thing is, from a third and final thing, it's always a big effort, is continuing the recruiting efforts, continuing the training efforts, continuing to pursue grant dollars to train more EMTs and paramedics. More providers on the road, always better to improve care.
Thank you. Anyone else? Go ahead, Charlie.
Just quick questions. Recruitment of staff, how you doing with that?
So the EMT academies have helped a lot. Our industry nationwide is struggling to recruit staff. And the old model, and I'll say pre-COVID, although we're not allowed to use COVID as an excuse anymore. So pre-COVID, people would pay to take an EMT class, and then we would wait for them to apply to come work at our place and hire them and hopefully move them on to the paramedic level. When COVID started, nobody wanted to pay to be an EMT then. So we decided to invest in hiring people and paying them to go full-time to EMT school. That has helped a lot. I think now in our current workforce, the last number I heard, there are 350 EMTs working for us now that have came through the EMT Academy program. So that payment full-time allows someone who always wanted to be an EMT but couldn't because of childcare or other job or whatever. Now they can do that, and it's on our dime. We've got people, since it has, I think we're in our 3rd year, and this is our 21st academy that starts in a week or two. We now have critical care paramedics who've started in the EMT Academy, worked for us, gone on, taken their paramedic program from us, and have moved all the way now to the critical care paramedic level. So recruiting into the industry is still challenging, but I think the direct wage, paying somebody full-time to go to class as their job, has helped us more so than agencies that just kind of wait for the applicant to come in. I will say that paying people full-time to go to an academy because they've always wanted to be an EMT doesn't always produce EMTs. So we're investing in about a 50% washout rate in those classes. People are getting paid, but by the end of the class, it's about 50% of what we started with. We see that as an investment that needs to be made. You know, we wish we could do better screening, but at the end of the day, they have to pass the state license to be valuable to us. So if they wash out along the way, at least when we get to the state test, I think the EMT program right now has about a 96% pass rate on the state test. So when they get there, they're doing a good job. That's helped us a lot. That is still the struggle, but making the investment up front. It's about $1.5 million a year that we invest in the EMT academies, and that investment is proving to be pretty valuable in a tough recruiting time.
Good. And my second question is, your trucks are forever on the road. When is your flip out on a truck and bring a new truck in? And I don't need this, like, is it 2 years, 5 years, or
It's 6
miles? How do you
six
do
right
that?
now, 6 years. With the preventative maintenance that we do, we have a very tight preventative maintenance schedule, so they're maintained quite frequently. In the Macomb operation, 3 full-time mechanics, 1 technician working on the vehicles. So right now, it's a 6-year life of the vehicles, providing we can get the replacement vehicles. We're still catching up on about 1.5 years of no vehicles, no chassis available. So we have some that are a little bit older than what we would like to see them. Obviously, can't invest in all new, all in 1 year, or we'll create ourselves a problem every 6 years. But
Yep.
as quickly as we can, we replace them and keep them in pretty good shape.
Good.
We get a lot of good feedback on the trucks. I will say one of the lowest levels on the patient satisfaction survey is the comfort of the ride. You're riding backwards in a truck chassis on Michigan roads. So, you know, we do our best, but we know it's a bumpy ride, even in the new trucks.
I would think that'd be the least of their worries, going to the hospital,
It's,
in an emergency situation.
The number of times the word shocks comes up on the patient satisfaction survey is surprising, and it's not defibrillation shocks.
Interesting. Well, thank you very much.
Anyone else?
Mr. Chairman, if I may, I was looking at your chart and you have request reasons, and the number one reason for, it looks like a call, is a sick person. Can you give me some examples of what defines a sick person?
Not feeling well, upset stomach, my shoulder hurts, my arm hurts. So don't think I'm trying to be flip. There are the dispatch criteria. I think there's 28 or 29 national response reasons: chest pain, difficulty breathing, fall, motor vehicle accident. If it doesn't fall into one of those, but it's a non-specific, I need you to come help my mother, she's not feeling well. My mom is not acting right. She seems a little lethargic today. Some of those general complaints don't fall into the specific other categories, even with other questions from the dispatcher. Are they bleeding? Have they been unconscious? Is there something else going on? If through the emergency medical dispatch process, they can't get to a specific complaint that fits into one of these, it's either unknown or it's a sick person. And the non-specific complaints come in a lot more than we'd like them to be. And that actually does sometimes drive the emergency responses when we get there and it's not an emergency patient. So we wish we could get more specific, but when we're categorizing what the public says to the 911 dispatcher, that's just how it comes across in the CAD.
So is it fair to say the sick person category is generally not transported?
No, there are, they're generally not emergencies, but they're generally not I don't think the transport rate is any higher or lower in that category. I would guess, and I don't like to guess with data, but I would guess that the rate of emergency transport in the sick person dispatch nature is very low.
Okay, that's all I have.
Thank you. Anyone else?
I just had a couple things, if I could. Keeping in pretty much Macomb County, how many communities do you service in Macomb County, roughly?
Six or seven, just going quick in my head.
And are you confident you can keep up with the rapid expansion and growth that we're having in, especially Macomb Township?
Yes, so the beauty of the CAD, the beauty of the technology that we use is it tells us where to put the vehicles based on the demand and how many vehicles need to be there. So now, traffic patterns notwithstanding, we know where to place the vehicles, how many need to be there at what time of day, move the post around time of day, and as the response volume grows, that information that comes back out of our systems to tell us where to put the vehicles grows with it. And sometimes the growth is not necessarily an additional vehicle, it's moving an existing vehicle so that it's better positioned between areas of demand.
Sure.
And again, with the idea of reducing the response time and reducing the need for lights and siren responses.
Sure. Thank you. Thank you.
Thank you. Anyone else? Okay.
Hold on, Mr. Chairman. I
Go
have
ahead,
a
Frank.
couple questions. What you just indicated is some kind of,
The state insurance, anybody who has Medicaid, we send a bill. We have a gross charge, and I'm going to tell you that I think it's $1,200 for an ALS emergency response. If that goes to a Medicaid patient, Medicaid says we pay you $180, and the rest, 100% of the remaining balance is written off to contractual adjustment. Get up into Blue Cross pays $450 of that. Blue Cross authorizes $450 of that. So Blue Cross says, and I'm using the top end of the insurance now, Blue Cross, we're authorizing $450, but Mr. Kuzmano has a $200 outstanding deductible that has not been met. So when you get a bill for $200. We've billed your insurance company, they've authorized the payment, but then told us back that you have a component that has to be billed to you. Under our contract with Blue Cross, to accept their $450 of the $1,200 bill, we're required to bill you that copay. Medicare patients, the same way. Medicare patients have something of a copay, depending on their program, usually early in the year. As their spend goes down during the year, that copay generally goes away. Medicare Advantage patients, unfortunately, find some less than advantageous coverage from time to time and are surprised when their copays come in because the Medicare Advantage program is not consistent. But again, that bill that goes to the patient is directed, we send the bill as directed by the insurance company. So the majority of the bill goes to contractual adjustment, and then if there's a copay or deductible, it's charged to the patient as directed to MedStar by the insurance company. So some patients will get a $15 copay, some patients will have met their spend for the year, will get no copay, and every now and then, early in the year, or based on some of the deductibles that people buy in their insurance, that they get the full $450 bill if it's from Blue Cross. One of the things that there's surprise billing legislation out there. And the Ambulance Association works with the Hospital Association, with all EMS stakeholders in Michigan, public and private, work on the same struggle. Surprise billing is generally, could be better categorized as, surprised I don't have coverage for this. You chose an insurance policy, or you're an employer chose an insurance policy that doesn't cover or has this high deductible. They approve the bill, but the high deductible, we have to charge it back to the patient. And as a contracted provider with the payers, and I think I've explained a couple times, so this might sound like a repeat for some of you. As a contracted provider with the payers, we can't waive that. And if we do waive that, we have to notify the payer that we didn't collect your deductible. So if you call and say, don't send Charlie his $100 bill, we'd like you to waive his deductible for him. Theoretically, we could, but we have to then notify Blue Cross that we did not collect a $100 deductible, so that spend that they're keeping track of for him is adjusted they're going to get that $100 from the next clinical provider that sends a bill.
All right, and the EMT Academy, is that still being taught at your facility on Gratiot Avenue in Clinton Township?
It's it's still on Gratiot, but it's at Gratiot and Metro Parkway now. We've got 4 classrooms in the basement of the McLaren Glass House, the big 4-story shiny building there on the corner of Gratiot and Metro Parkway. The classrooms are downstairs in that building. We've expanded, the classroom site at Gratiot couldn't handle the student load.
Oh.
Actually, the parking lot couldn't handle the student load, so we leased classrooms in the bottom of that building.
All right, thank you for that. And do you still have those mannequins that interact with the students?
We do. And the simulation mannequin crowd is expanding, and its technology is becoming even more, it's pretty impressive. Happy to show you anytime you'd like to see them.
Yeah, I've seen it once before, and I made the comment to one of my fellow trustees or who was on the committee. I know how expensive those mannequins are. They're hundreds of thousands of dollars. Thank you, sir.
Thank you.
That's all I have.
Thank you, Trustee Kuzmano. Any other? Go ahead.
One
Peter.
more follow-up, if I could. You were going over the prices to the residents. What if somebody had no insurance? Is there a discounted rate, or is it the $1,200 that you talked about, or is it even more?
So it's never more than the gross rate. We will always work, if somebody calls our office and says, I've got the bill, I don't have insurance, I want to work out a payment plan, we will generally pick the average rate for the community. We'll work out a payment plan as long as we got people paying $5 a month.
Sure.
The only time that we get twisted up with patients is when we get no contact. We use the email, or we use the phone number that we have, we use the address that we have, we send 30, 60, 90-day billings, we get no response back. At 180 days, the bill goes to collections. And we will double check with the hospital databases to make sure we have the address right. We will double check with the payers to make sure we're putting the information in correctly. That's very infrequent. Because of the insurance regulations that we work under, when someone comes in, or someone calls or comes in and says, I'm having trouble with my bill, we have to get them to fill out a form that says, this is my income, these are my bills, so we can do a charity write-off. And we do a ton of charity write-offs. But there's a little bit of a process that goes with it. Some people get a little abraded by the questions, but we want to make sure that if an insurance auditor comes in and says, hey, wait a minute, you just wrote this guy's bill off, here's why. Here's the information he gave us, here's the data that we had, and this is the decision we made. So there's a lot of ways for us to handle that situation when it comes up, as infrequently as it is, and we work with everybody who calls. We do get fairly high satisfaction from the billing office on the patient satisfaction survey. I hear them on the phone with patients. Most of the billing questions are not about how much they owe. It's about, what does this mean on my bill? What does this mean on my insurance statement? What's the difference between a copay and a deductible? We do more insurance counseling than we do financial collections.
Sure. Thank you.
Any other questions? All right, Mr. Miller?
Thank you.
Appreciate the time. All right, we're going to move on to our first new business item. This is the one that we just added. So if I could get a motion to approve a budget amendment regarding the allocation in the current budget for 21 in Heindreich intersection improvements.
So move, Mr. Chair.
Support.
So before we enter into any discussion, I'm going to ask Senator Kleinfeld to give us an update on,
That way.
right there at the podium with the microphone, on some news from the state.
Listen, I don't ever call an ambulance if I'm sick, but the idea of being able to call if my husband isn't acting right, I kind of get excited about that. So last year, Supervisor Viviano, Clerk Posey, and Treasurer Gillette contacted me and said, we'd like to have lunch with you. That's never a good thing in my book because I know that means they want something. So I met with them and they sat down and they explained the intersection of 21 Mile and Heidenreich Road the amount of schools there, which I believe within a half a mile, there's like 5 schools there. There are 3 in very close proximity. I actually had to go up there for an event just as school was getting out. I think it was for the high school, and it was just a nightmare for the kids that were trying to get across the street. I couldn't believe the setup. So the ask was $4 million, and I said I would do whatever I could. So originally I was able to get $4 million in the budget. I don't sit on the committee that budget was through, but I was able to get them to agree to put it in. Anyway, through negotiations and some give and take, and the last day of session was 20 hours long. I didn't think any of it was going to survive, but 3 million of it survived when it all shook down. And I'm very excited to be able to get that money for you to be able to help make things safer for the kids over there. This is what you would call an earmark, and we've been getting hit hard on pork projects or earmarks. Every one that I ask is a critical infrastructure or a safety request. I have seen things in the budget in the last couple of years that, quite frankly, I find appalling. But when you're investing in critical infrastructure in communities, in my opinion, there's a whole argument over what attracts people, what attracts businesses. You've probably seen we're investing a lot in bringing in, businesses into the state, but I think nothing keeps our educated workforce and brings businesses into a state than investment in communities. And this hit all of my keys for importance. It was safety, it was a road investment, it was an investment in the community. So for me, it was an easy ask, and I'm just thrilled to death that I was able to deliver that.
Well, I guess on behalf of the entire board, and I'm sure every board member here is going to want to express themselves, but we can't thank you enough for going to bat for us once again, even though after the last time you told us not to ask for anything.
I did. I said, don't ask me anymore. I can't get you anything.
You did. And you delivered again. And that $3 million is going to finally, after literally years of trying to address that problem, long before I got here, that intersection was a problem. Finally, we can do something about it. So thank you.
Thank you.
So if you wait, stay put there with some questions.
A round of applause is appropriate.
I'd like to have anybody ask some further questions before we present this.
We have a little gift for the senator, so before we do that, is there any more questions or compliments for Senator Kleinfeld?
Mr. Chairman, I would just like to say we truly appreciate all the hard work you've done for Macomb Township. From your first day of office, you've gone to bat for us, and that intersection, I personally live near it, so it will be much appreciated in that area by all the residents that live in that section. So thank you very much.
Thank you. The last time you offered me gifts, I ended up with my head on Mel Gibson's body, and that's in my office. And there are a lot of comments about that when people come in.
So, Mr. Chair, if I may,
You may.
Between the $5 million you brought back from Lansing last year for the Broughton Road extension, which is now in the planning process, and we're moving forward with that, and this $3 million, that's when you divide that by the number of households in Macomb Township, it comes to several $100s per household. Now, that's money that people have been paying in their state tax dollars and not seeing come back to our community. So the fact that you're able to bring hundreds of dollars per household back to Macomb Township to address our critical safety issues like 21 Heinrich. As you know, anybody who lives in Macomb Township knows there's no right turn lane available there at 21 Heinrich. The center turn lane is grossly short. The signaling is not as safe as it can be. So by addressing this, you're helping the residents, not just the commuters, not just the people who drive on the roads, but and enhancing the safety of the children at those 5 schools. So that means an awful lot to us, and I really appreciate that you didn't just go to bat for this community once, but you went and did it again, and you're showing a commitment to the residents of Macomb Township. So
Thank you.
Anyone else?
Yes, I would like to
Yes.
say something. I've been on this board for 20 years. Not this board, but a member of the boards for over 20 years. I've never seen that kind of attention to our township. And I just want to say thank you so much. And it's really, really appreciated and noticed.
Thank you.
Thank you, Trustee Nevers.
If the chair, if there's,
Go ahead, Trustee Lucido.
Just wanted to say thank you. I echo the same thing. It's long overdue on that area, and I utilize that area quite a bit to go to Dakota for football games and to Seneca for my son's little league, and it's just horrible over there, and it's definitely much needed for the community. So thank you.
Thank
Trustee
you.
Lucido.
I'm an infrastructure gal. That's the thing I go after in Lansing all the time. Infrastructure, infrastructure, infrastructure.
So unless somebody else has anything else,
Got one
go ahead,
thing,
Charlie.
just quickly.
I
Again,
figured we would all want to say something.
like my colleague said, thank you. But it is interesting that many times people come to that podium and tell us who they are, they're a senator, they're this or that, but never do nothing. You've actually delivered twice in a year, and that is a lot. And again, for me, for living here for 55 years and watching that be a gravel road turn into a expressway now with no room, that's going to be well used, that money. So thank you very much.
Thank you. I appreciate it. I mean, I think I'm just doing my job, but thank you.
so
Yeah.
So we're gonna take a.
Chair, if we could have a brief recess,
That's
I'd
right,
like to
so
get a
let's call
group
for
shot
just
with
a
the
brief
senator.
recess. We're not done with this agenda item. We actually have a little bit more to talk about, but we're gonna take a little brief recess for a photo op. The whole board? Yeah. Projector in the way, so maybe we'll. Thank you, Senator. So with that, and again, this budget, this is a request for a budget amendment for the money that we had allocated in the 2025 budget for improving the intersections, which, as it stands now, is $750,000. We put that money aside. We knew it wouldn't fix the entire intersection, but we had hoped it would be enough for some matching funds, for some federal or state grants, or some other resources, or at least enough to get some design work done. But as it stands, we may not need that.
I realize, Mr. Chair, that, well, the motion's been made for the amendment, correct?
That is correct.
Okay, so I know our finance director is available, but we had set aside $750,000 in a way to try to get this project moving forward in some capacity. And it would have taken us multiple years, but with this assessment, or rather this appropriation from the state, we can now accelerate that greatly. The good news is there is now the $750,000 that we had set aside to start trying to save toward this project. That funds now, a decision needs to be made by this board as to how we could allocate those funds. So I know there's been a lot of discussion about where the needs are, and I would just refer back to a meeting that the supervisor, myself, our Parks and Rec director, Mr. DeCaro, and Ken Delper for our Parks and Rec Department had with one of the providers for the new playscape at Waldenburg Park. We had put $500,000 in the budget to replace the 20-some-odd-year playscape at Waldenburg Park. And there was, in looking at the presentation, there were some disappointments in the scale of the project that was being offered. And when I brought up concerns about that, it didn't seem like we're getting a lot of play for $500,000, it was explained to me that we had a choice. We could either make the playscape as accessible as possible for every child, including those with disabilities and so forth, and that's more expensive to do. That adds a lot to the cost of a playscape. Or we can add more features but make them less accessible for some of the children. And so that would be one area we could consider allocating more resources to expand that accessibility and the features available at the new playscape.
Thank you. Thank you for that explanation, Trustee or Treasurer Gillette. So I just want to ask real quick before we allocate any money from that fund, Mr. Van Tiffelen, you and I have had this discussion, but with the $3 million that the senator got allocated to Macomb Township, are you comfortable that we can make all the improvements to that intersection that we discussed and that are needed for the safety of that intersection?
I am.
So it seems like we have some extra money we can move to something else.
Mr. Chairman, in lieu of this discussion where we do have, I'm estimated around 250,000, is that correct? Okay. That in light of the state allocation to improve 21 Mile Road and Heinrich Road intersection secured by Senator Kleinfeld, she left, but I would like to make a motion to reallocate a portion of the funds in the 24-25 fiscal year budget. So I move to redirect $250,000 from the capital improvement budget and add to the funds previously allocated to replace the play structure at Waldenburg Park. This additional $250,000 will future ensure the new play structure engaging in the beneficial for all Macomb Township children. So this way, anyone can play on this stuff, and if they have a disability, they can play on it. If they're kids, they can play on it. Everyone has a spot to be able to play in this playscape. And that's my motion.
I'll accept that as a friendly amendment to the original motion, I guess. Is that more correct, Madam Clerk? So there was
Yeah, I'm sorry.
there was a motion before us, correct? Which was the reallocate, or was that not a, okay.
That was the motion, yes. It was just a reallocation without any specificity in it.
So I believe procedurally that.
The motion maker would
Trustee
have to
Oliver,
agree to that amendment.
Absolutely agree to,
Trustee
Trustee
Lucido, would you agree
Oliver's.
to second that?
Agreed. Second.
So the motion is to amend the current budget to reallocate $250,000 from the 21 and Heinrich improvement to Waldenburg Park to increase the handicap accessibility in the of that play structure. That's correct?
Yep.
So it just so happens that finance or township CFO prepared us a resolution to that effect so that we can properly amend the budget. Clerk Posey, will you read that budget, or I'm sorry, that resolution?
Yes, Mr. Chairman. At a regular meeting of the Macomb Township Board of Trustees that was called to order by Supervisor Frank Viviano on Wednesday, July 24th, 2024 at 6:30 p.m., the following resolution was offered. Whereas the municipal roadway fund expenses need to be decreased from $7,638.50 to $7,388.50. Whereas the public improvement fund expenditures need to be increased from $1,255,500 to $1,505,500. Now therefore be it resolved that the municipal runway expenses will decrease from $7,638 $638.50 to $7,388.50. And the public improvement fund expenditures will increase from $1,255,500 to $1,505,500.
That was a lot. So before I call for a roll call, I do want to point out one more thing, is that our request to Senator Keinfeld and her very hard work of securing that $3 million is a double win for the township. We get to improve a very difficult area of our township to traverse through. And we also get to nearly double the capacity of what we were originally allocated to do at Waldenberg Park. So that's the kind of thing that when one of our senators or congressional representatives goes to bat for us, that's what it allows us to do, is to bring even more improvements in other areas besides what they've won us the money for. So with that, Clerk Posey, we call the roll.
Yes, Mr. Chairman. Treasurer Drollet.
Yes.
Trustee Lucido.
Yes.
Trustee Kuzimano.
Yes.
Trustee Oliver.
Yes.
Trustee Nevers.
Yes.
Clerk Posey, yes. Supervisor Viviano.
Yes, that resolution is adopted. Thanks, Stacy. All right, moving on to item 10. As a request for an authorization for the Township Supervisor to sign a quitclaim deed for the dedication of the ultimate right-of-way for the township-owned properties. These would be parcels 0820-426-026 and 0820-426-028, otherwise known as Pitchford Park properties.
Motion to approve.
Support.
Is there any question or discussion? Oh, I'm sorry, Mr. Van Tiffelen, why don't you give us some background before I
Yes,
move
Mr.
along?
Chairman, board members. Macomb County Department of Roads has gotten to the point with the design of the widening of Romeo Plank that they're comfortable with proceeding with the dedication of the portion of the right-of-way that is adjacent to Pitchford Park. They have provided us with the documents that are in the board packet. This has been reviewed by engineering. It matches up with the design of Pitchford Park, so this won't have any effect on the park as it exists currently. So we are comfortable recommending approval.
Thank you, Mr. Van Tiffelen. And just a quick question, we're still gonna go back and combine these two into one?
Eventually, yes.
Yeah, okay. Any other questions or discussion? Motion by Clerk Posey, supported by Treasurer Drollet, to authorize the Township Supervisor to sign a quitclaim deed for the dedication of ultimate right-of-way for the Pitchford Park properties. Members, please vote. Motion passes unanimously. This will take us to item 11, is a request to promote employee 2509. Is there a motion?
So moved.
Support.
Mr. Tabaka.
Thank you, Mr. Supervisor and board members. I am looking to promote Erica Marchetti to the position of Administrative Assistant in the Parks and Rec Department. Erica has been in a clerical role for the past few years within the Parks and Rec Department and has taken on additional responsibilities and has excelled in this position. The Parks and Rec Director, Salda Carl, and myself are recommending Eric to be promoted to Admin Assistant. This is a budgeted position. If approved, the promotion will go into effect tomorrow. Thank you for your consideration and happy to answer any questions.
Thank you, Mr. Tabaka. Any questions or discussion? Hearing none. Motion by Clerk Posey, supported by Trustee Oliver, to promote Erica Machete to Admin Assistant. Members, please vote. Motion passes unanimously. That'll take us to item 12, is a request to promote employee 2923. Is there a motion?
So move.
Support.
Mr. Tabaka?
I'm looking to promote Dakota Erler to the position of DPW Inspector. This position is open due to a recent resignation. The selection committee consisting of myself, Kevin Johnson, and Ed Koenig believe Dakota will be an asset to the DPW team as an inspector. Dakota holds an S4 license and has over 6 years of experience in the industry. Again, a budgeted position. If approved, the promotion will go into effect tomorrow. Happy to answer any questions.
Thank you, Mr. Tabaka. Any questions or discussion? Hearing none. Motion by Treasurer Lett, supported by Clerk Posey, to promote Dakota Erler to DPW Inspector. Members, please vote. Motion passes unanimously. Congratulations, Dakota. And our next item is a request to hire a full-time firefighter. Is there a motion?
So moved.
Support.
Jeff?
Thank you, Mr. Supervisor. Looking to add a full-time firefighter to the fire department. The position was approved in this year's fiscal budget. Myself, Chief Phillips, and DC Monroe interviewed 3 candidates, and we are recommending Ron Tremonti for the position. Ron has been a paid-on-call firefighter with the township for over 15 years. Ron has done an excellent job as a POC firefighter, and we believe Ron will make a great full-time firefighter. If approved, anticipated start date would be sometime in August. Happy to answer any questions.
Thank you, Mr. Tabaka. Any questions or discussion? Hearing none, motion by trustee Oliver, supported by trustee Nevers, to hire Mr. Ron Tremonti as a full-time firefighter. Members, please vote. Motion passes unanimously. Congratulations, Ron.
Ron is in the audience right here in the suit.
Just don't do anything when Jeff is around. It's a black cat. All right, moving on to item 14. This is a request to approve a special event for New Vision Health Center located in the south side of 21 Mile Road and near Hayes, permanent parcel 0831103001. Is there a motion?
So move.
Support.
Mr. Box.
Thank you, Mr. Chairman and Board. The New Vision Health Center, which is located near 21 Mile and Hayes, as you mentioned, is looking to have a series of special events. The ordinance does allow us to administratively approve up to 4 special events per year. However, these special events are required to be at least 28 days apart. What they are seeking to do is have these special events, which they're referring to as farmers markets, 2 weeks apart in a series. So they've already had one, which was approved administratively on July 13th. They're seeking 3 additional ones on one on July 27th, one on August 10th, and one on August 24th. And per ordinance, that would require a board approval.
Thank you, Mr. Box. Is there any questions or discussion?
Mr. Chairman, I have a couple questions. Has there been any, have they gotten the permits before and had the farm market up and running on their property?
They had one on July 13th that they did come in and get formal approval. We worked with them. They were initially planning to have this in the front of their building. We had some safety concerns. They met with myself and some representatives from the fire department and the building department. We worked with them to put that in the rear of the building, and that's where they had the event on July 13th, and that's where they would have these additional events if approved.
So it's anticipated that it won't pose any threat to the health, safety, or welfare of any township residents. Is that a fair statement?
That's correct.
All right, thank you, Mr. Chairman, that's all I have.
Thank you, trustee Kuzmano. Anyone else?
I get a couple questions.
Sure.
Is the petitioner here or no?
Yes.
Where are they? Hi.
Yeah.
Couple quick questions. Is there a reason why you're calling it the Macomb Farmers Market?
Because it's a farmer's market in Macomb.
Okay. 'Cause
That-
generally that
That's really
it
it.
represents an event that we do here.
Oh, no,
that we're
no.
sponsoring, and we don't, me for one, don't want to get the people confused that we're sponsoring something.
Yeah, a lot of times when these are just done in different cities, it's just city name, farmer's market, so there's really not much more thought behind it than that,
Chair, if I could just interrupt for a moment, just for the record, if you would please state the name of the gentleman. I'm
Sorry.
Nick Zorowski.
Thank you.
So what prompted you to put this out?
Yeah, I have patients that come into my place, and they're just small, I guess you call them business owners in the sense that, they bake bread, maybe they make jam, stuff like that. And they asked if they could do something along this line where they could bring their stuff and sell it, at our facility. And, they really kind of started that. And I'm a small town person, so, I think community events like that are fun. And I think it's fun to be able to bring our community together. And it gives a lot of opportunity to people who may otherwise not have it, like people who come out to our event. We have a lady in her early 20s who's handicapped, and she makes dog treats, and there's a young girl who's 13 years old who makes lotions, just simple things like that. People who make, different baked goods, things of that nature. So it gives them an opportunity. And so other than that, there really is no other reason other than just trying to help out some of these people.
Beta, you calling it a farm market. Are there any farmers there?
Yeah, there are farmers. Yep, there's farmers who come out and bring their products. And
what are they going to bring?
So we get some vegetables, some fruit. I'm trying to think of some of the things that have been out there. There's farmers who raise beef, chicken, stuff like that.
So, are you aware that we have farmers in the township with farm stands?
I guess, yeah, like farm, yeah.
Okay.
Mm-hmm.
I just want to make sure you knew that there are farmers making their living off doing that on their farms, and
Sure. And any of them are welcome to come out. To be honest with you, this is not anything that benefits me in any way. I do not make money. My facility does not make money. Actually, it costs me a lot of money to do this. I really, the only reason I'm here is really to petition for the people, like I said, that come out there that make a couple bucks that otherwise wouldn't have that opportunity. Our goal is not to compete with anybody or take away from anybody. Any farmer is more than welcome to bring their stand out there and do this type of thing. We're welcome with open arms. So
I'd suggest you might want to talk to some of the growers. They're all qualified growers. They grow great products.
we'd love to have them.
Yeah, they're in our township. I think we list them, don't we? Right?
We have them somewhere, yeah. I've been to their venues and promoted them
Yeah.
as well.
Yep.
Okay, that's all I want.
So
That's it.
I guess just to Trustee Oliver's point, there's a bit of a sensitivity to our farming community that's in the township. Certainly, we want every entrepreneur in the township to get an opportunity, and that's what you're providing, so we applaud that. But sometimes in our community, there's a misunderstanding that we don't have a, quote, farmer's market, yet we do have 5 fully active farm stands and a number of others that put out some of their produce and some of their product in front of their farms as well. So I just want to make sure that's understood, that we do have plenty of farm markets in the township.
Yeah, and I mean, our goal would obviously to be promoting anybody local. And like I said, anybody local is more than welcome to come out. As a matter of fact, we have called many of those different farms and invited them out. So
Okay, well, that's good. I appreciate that.
yeah, absolutely.
Anyone else?
I had a question if I could.
Yeah.
There's no like alcohol or marijuana or cannabis or any of that kind of stuff, is there?
No, I mean, we're a healthcare facility. I mean, I probably care more than anybody in this room what happens on our facility and what that looks like. So, I mean, our goal is to keep this a small event and obviously keep it safe, family friendly, and no shenanigans like
Sure.
that. Yeah.
All right, thank you.
Thank you, Trustee Lucido.
Mayor?
Yes.
What are the hours?
Saturday 9 to 12.
Okay, thank you.
Yeah. And it's just every other Saturday, so it's not even every Saturday.
Just one quick
Go ahead,
question to Josh. Josh, is there going to be adequate parking for that?
Yeah, we did communicate that with them, that we had some initial concerns, but their business is not open during the time of this, so we're comfortable with the parking.
Okay, thank you.
Anyone else? Okay, thank you.
Yep.
So we have a motion by Treasurer Gillette, supported by Trustee Lucido, to approve the special event for New Vision Health Center. Members, please vote. Motion passes unanimously. Request to amend, moving on to item 15, is a request to amend the planning ordinance, Chapter 14, Article 4, collection containers. And as Mr. Box tells us what's going on, you're going to see some slides from our recent effort come up behind me. Go ahead, Mr.
So
Box.
first, I'd like to make the motion.
Oh, I'm sorry. Did I not ask for that?
That's right. Make the
If you
motion
if you
to
have to, go ahead.
amend the planning ordinance, Chapter 14, Article 4, collection containers.
Support.
Okay.
Now, Mr. Box can tell us about these wonderful slides.
Yeah, thank you, Mr. Chairman and Board. So as you may recall, this past spring, we did adopt a collection container ordinance. We started, as you see in these pictures, to get some unsightly conditions, and they were popping up all over the community, many of which were not what they seemed to be in terms of people thinking they're giving to a charity and they were a for-profit business. So we did launch this ordinance. There were 48 containers within the township. 47 of them have actually been removed. One is very near completion of the approval process, and we actually just got 2 more applications today. So there's a potential for 3 total in the township at this point. But in that process, in these first few months, we did come up with a few minor tweaks to that ordinance. Initially, we were hoping to approve these annually, but using the fiscal year, and since then we've decided to change that to the calendar year, and additionally to clarify the approval process to be through the Land Development Department.
Thank you, Mr. Box. Anyone else?
Mr. Chair, if I may, I sort of became aware of the effect of our ordinance when I swung by the Taco Bell at 26 and Kroger for lunch, and one of our ordinance enforcers was out there taking photograph of the donation bins, which essentially looked basically like this. You know, the more as I looked up and did some research, finding that, you know, these bins are not, many of them are not for nonprofits. Many of them are, you know, for profit, and many of them are, in the case of a place like at Kroger, the property owner may be a company that's unaware that these bins are even on their property. In particular, there's a few closed businesses or businesses that are for sale where these bins all of a sudden pop up, and the owner is unaware that these bins are on their property. So there's, you know, it's not a situation where there's a legitimate charity that's got a record of, you know, donating this for the good of their charitable cause, and they have the permission of the property owner. It was kind of the Wild West of collection bin containers that was creating an eyesore, and I think leading to misrepresentation among people, what they expected they were doing, you know, donating to a charity, and what the reality was.
Thank you, Treasurer Gillette. Anyone else?
Mr. Chairman, I have a couple questions. What is it about the wording of the statute as enacted that was problematic warranting this amendment? In other words, was there any real world deficits that came to light after the ordinance was enacted and we began to enforce it?
So the first one would be the approval process. It was a little unclear who had the final approval, so we highlighted that to say the Land Development Department. And then additionally, there's one minor word change from side and rear setbacks to side and rear yards. So there was some confusion about where if they go through the approval process, where they could actually be located. So we cleared that up by changing the word setback to yard.
Okay. And do you think that this draft covers all of the contingencies and will further effectuate the goal of regulating this activity?
I do.
All right. Thank you, Mr. Chairman.
Thank you. Mr. Box, I know code enforcement was all over this because actually the idea came from code enforcement. Do you know roughly how many recycled containers were removed because of this?
So there were 48 identified in the township. 47 are now gone.
Good. Anyone else?
So this is a follow-up. Right? There's only one left in the town.
So the one that's left will probably get its formal approval this week, and then we got an application for 2 others today. So a few of the other ones that were removed, it is our understanding that they do intend to come in and follow the process and get them approved. But in the interim, we asked them to remove them, and they did.
Good. Thank you.
Biggest benefit is that we now have a responsible party to contact when these things become unsightly, overflowing, and a nuisance to the township.
Yeah.
Okay. There's no more questions. I got a motion by Treasurer Gillette, supported by Clerk Posey, to amend the planning ordinance on Chapter 14, Article 4, collection containers. Members, please vote. Motion passes unanimously. Let's take us to item 16, a request to purchase additional Laserfish user license.
So move.
Trustee Kuzma supports the motion.
Mr. Pierce.
Thank you, Mr. Supervisor, board members. Before you tonight to request that you approve the additional purchase of 15 full user license and 15 participant user license for Laserfish document imaging system. We've allocated all the participant user license previously purchased, and we are below what our normal minimum threshold is for the full user license. By doing this, this allows to assign them as they are requested. This is a budgeted item. However, the recent line item for that number has just changed. I'd spoken with the financial officer, and she will put the correct line item reference number into the purchase order should this be approved.
Thank you. Any questions or discussion? Hearing none, motion by Treasurer Gillette, supported by Trustee Kuzmano, to approve the purchase of additional Laserfish user licenses. Members, please vote.
Oh, no, we have a box.
You stalled, Roger.
All in favor?
We are doing so good.
Almost made it.
We're halfway home. We're doing so good. All right, all in favor? Aye. All opposed? Motion carries.
Thank you, board members.
Mr. Chairman, if I just may make a comment, I just want to say that several communities have contacted our office on our Laserfish management, and that's thanks to Mr. Pierce. He does such a phenomenal job at our record management and keeping, and we are an example to many communities that ask us for assistance on how to follow our lead. So you do a wonderful job with that.
Thank you very much. I appreciate that.
Let's take us to item 17. So this is a request for the Township Supervisor to extend our grant writing services with Team Row at an hourly rate of $100 per hour, not to exceed $18,000 in the fiscal year 2024.
So move.
Support.
I think that should say calendar year 2024. Or is it 2025?
I think the existing contract
We're
lined
past,
up with our.
we're past fiscal year 2024, correct?
We're in 24-25.
Correct. So it's calendar year 2024.
No, it's
Or
fiscal
fis-
year 24-25.
You're right, fiscal year 2025.
Yeah.
Okay. Sorry about that. Do I have did somebody make the motion?
By Posey, supported by Bullock.
All right, I've supported Posey's motion then.
Yeah,
Fine.
we're good. Sorry, Liz.
This is totally fine. I don't really have too many prepared remarks. I just wanted to thank the township again for their trust in me in providing grant writing services. I know that when we embarked upon this journey in 2022, we really kind of both didn't know what we were doing. All we knew was that there was money that we were not capturing that could be brought back to the township to improve the quality of life for the residents. And I think we've learned a lot over the last 2 years, and we've determined what does and does not work for our township. And as a result, I'm pleased that I am able to still provide grant writing services to the township, but at a much more discounted rate than what I was doing previously. This is a cost savings, and as a township resident, I definitely appreciate that. But this type of arrangement will allow us to continue to pursue those grants, but do it far more strategically based on projects that we have previously identified, as well as those that might pop up and those opportunities that might come along the way. So I believe that this contract and this arrangement will fulfill the needs of the township for the next year to come.
Thank you, Liz. So I'll add a little bit more to that. So since we started going after grants a few years ago, and then I brought on Deputy Supervisor Claycomb. She's really taken the lead from the township's point of view, sort of all grant efforts. And one of the things, Liz is right, we didn't know, there's a lot of things we didn't know. We have learned that Macomb Township will always struggle to qualify for many of the grants that are out there in the municipal world. But that doesn't mean we're going to quit trying, but we're going to be much more targeted with how we spend our time and our energy, and Liz's time and her energy. So moving to an hourly model will allow us collectively, both Team Row and the township, to look for and try and identify grant opportunities. And when we find one where we need Ms. Row's help, we're going to ask for her assistance on an hourly basis. There are going to be plenty of opportunities that come up internally that Deputy Supervisor Claycomb, along with the department heads, can manage. But it is going to be a consistent effort, and we're never going to give up on getting grants and tax dollars back to the township. So with that, I will take any questions.
Mr. Chair, if I may add to your comments?
You can.
Thank you, Mr. Chair. So last year, the township brought in $12 million that had not been previously brought in through a series of, whether they're appropriations to the state, grants that we worked on, grants that our department heads worked on. So it's really has been a team effort as we've come together as a community and said, you know, we need to get some of those tax dollars that our residents pay back into our community. And we hope to continue with the success that we built on last year, and having your services is an integral part of that process. You know, it's always going to be the department heads having some area where they are playing a lead role, and others where we need different hands on deck. So I appreciate your being an important tool in the toolbox for getting that money back here to Macomb Township.
Thank you for the opportunity.
Any other questions or discussion?
Oh, go ahead, Charlie.
Just follow up, Leanne or Liz. How much money did you collect last year?
For the township?
Yeah.
Oh, I knew somebody was going to ask
Just
me
off
that
the
question,
Our
and I
big
don't
one was
remember.
the DNR grant last year is what we got, which was
It was 1
$750,000.
No, the DNR trust fund grant was over $1 million.
Oh, that's right.
Yeah.
It was up to over $1 million. Yeah.
Yeah, and so, also, I think the TAP grant was the previous year, is that not correct?
Yes.
We brought in $12 million last year through a series of things. Some of them were appropriations of $5 million for Broughton Road.
Yep.
Some of them were the lighting project for LED lighting in the township. Some of them were the other grants we've gotten for the parks at REC. What was the Kresge grant? Is that not the Kresge grant? The one that helped pay the TAP grant?
Yes, the Michigan the Southeast Community Foundation of Southeast Michigan.
Right.
Was and then also there was a TAP grant. The Community Foundation for Southeast Michigan was part of that match. We leveraged those funds to get the TAP grant, and then also we had funding help from the county as well.
So, and not to interrupt, but we're in the process. We have a few outstanding grants,
Right.
some that we've applied for, some that we hope to apply for. I know that we've been in conversation with Ducks Unlimited to help us over at Lucido Park, and we haven't really pursued that one yet because we're still getting some work done from our engineering firm and trying to get an Eagle permit. So there are a number of things on the horizon as possibilities, and Ms. Rowe and our team will continue to look for other opportunities.
I think we interrupted Charlie.
I
Starting
know,
with
I
my
sorta
interruption,
did.
I apologize. Char- I apologize for interrupting
I
you.
interrupted his interruption.
No,
but go
no,
I
ahead,
didn't
Charlie.
interrupt you, and he kept interrupting me.
And I know there's so much energy that
Pipe
goes
down over there.
into this. And thank you for all your work and along with our people, and makes things happen. So thank
Thank you, Charlie. Peter, you had something?
That was basically what I was asking was, how much, I want to make sure we're providing value for what we're paying for, and I know a lot of them come from a lot of different areas. Is there any quantification we can say came directly from this contract of, what are we bringing in directly from this contract?
Yeah, I believe that in the previous reports that I've provided, we do provide a summary information of the ROI on that. I don't have it immediately in front of me. I apologize. My family was actually utilizing the MedStar ambulance earlier today. My mother has COVID and had to go to the hospital, so I was not able to. I kind of rushed here, but we did talk about the return rate on the cost of the grant writer versus what we obtained, and I believe that the ratio is quite generous.
Yeah, our return has been, well, we got a couple of big ones, we got a few little ones. And, you know, it's a numbers game. We're going to keep applying for them, and there's going to be a lot we don't get. But we just need the next big one to make it all worthwhile.
If you don't ask, the answer is always no.
That's correct.
Thank you.
Mr. Chairman, I have a question. Is the 18,000 budgeted, or is it?
Actually, 36,000, I think, is budgeted, and this will be
Yeah,
half of
So we're
that.
gonna find some more money to move around.
That's right. In theory, that's correct.
All right, and I just want to make a general comment that, so the residents understand, this is what's known as competency of leadership. It's creative solutions to an age-old problem. Where's the money? Although nothing's free, you know, when all these infrastructure projects come through the state, it has an inflationary effect. But at least Macomb Township is getting something for its dollars that we send to Lansing. I want to thank the elected officials for proving out that there are other ways of providing benefit to the residents other than just raising taxes. And that's all I have, Mr. Chairman.
Thank you, Trustee Kuzma. It was very generous. Anyone else? Motion by Clerk Posey, supported by Treasurer Gillette, to request that the Township Supervisor, or to have the Township Supervisor extend grant writing services with Team Row at an hourly rate of $100 per hour, not to exceed $18,000 in fiscal year 2025. Members, please vote. Motion passes unanimously. Thank you, Liz.
Thank you.
I hope your mom is okay.
Oh, yes. Hope the ride wasn't too bumpy. Next item is a request to adopt a resolution to participate in the opioid settlement for Kroger. Is there a motion?
So moved.
Trustee Kuzma supports the motion.
So this is one in a series of opioid settlements that has been presented to the township through the Attorney General's office. These are national settlements. We are given the opportunity to opt in. If we choose not to, basically, we don't get anything unless we choose to pursue litigation ourselves. I can't remember what the number is. I don't have it in front of me, but I believe this one was $27,000 over 11 years approximately. Those numbers can change depending on the number of communities that opt in or opt out. That's based on every community in Michigan opting in. With that, I'll take any questions. Oh, I will say that this was all reviewed by Township Council, and he has signed off on us opting in. Anyone? There's no questions. Motion by Trustee Oliver, supported by Trustee Kuzmano, to approve or to adopt the resolution to participate in the opioid settlement with Kroger. Clerk Posey, we call the roll.
Do you want me to read it?
Sure, let's do that.
At the regular meeting of the Township Board of Macomb Township, Macomb County, Michigan, held at the Township Hall at 54111 Broughton, Macomb Township, Michigan 48042, on the 24th day of July 2024, commencing at 6:30 p.m. The following resolution was offered by Trustee Oliver and supported by Trustee Cusimano. Whereas the state of Michigan officially signed on to a national opioid settlement with Kroger, and whereas the settlement identified Macomb Township as a local government entity eligible for direct payment allocations, and whereas the allocation to each Michigan local unit of government is correlated to the number of eligible entities registering for participation in the settlement by August 12th, 2024. Now therefore be it resolved that Macomb Township Board of Trustees does hereby authorize the supervisor to enroll Macomb Township as a participant in the state of Michigan's Kroger opioid settlement. Any and all resolutions in conflict herewithin are repealed only to the extent necessary to give full force and effect to the foregoing provisions. This resolution is deemed severable. Should any provision, clause, word, or sentence be deemed unenforceable, the remainder shall remain in full force and effect.
Okay. Clerk Posey, we call the roll.
Yes, Mr. Chairman. Trustee Oliver?
Yes.
Trustee Cusimano?
Yes.
Trustee Lucido?
Yes.
Trustee Nevers?
Yes.
Treasurer Drollet?
Yes.
Clerk Posey, yes. Supervisor Viviano?
Yes, that resolution is adopted. Moving on to the discussion and determination of how to proceed with 2156023 Mile Road. So at this point, I'm going to ask for a motion to open discussion only.
So move.
Support.
So, as I presented this in the memo, a couple years ago, we purchased this property, 2156023 Mile Road. It is adjacent to a pump station. Mr. Johnson, why don't you come up to the microphone? That was being completely renovated and redone. That was an extensive construction project. The couple things were going on. We were concerned that the heavy pounding of doing these large pylons into the ground was going to damage the neighboring structure. The family that owned the property, after a family member had passed away, was about to put the house on the market anyway, so it had been just recently vacated, and the construction company needed a place to stage for the work. So all those factors considered, the township made the decision to have the property valued, and we paid $195,000 about 2 years ago when we purchased this property. Now, the construction project is substantially complete. It should be completed, I believe, by end of September, we hope, right?
Yeah, it's not, as of yet, it's not substantially complete. It should be by September 1st is the actual
September
contract.
1st is the actual date of the contract, but
Yes.
we're expecting maybe a month or so delay, right?
We're waiting on DTE and Consumers Energy to hear back
Okay.
from them so we can get some utilities run
So,
to the station.
in anticipation of the project wrapping up, we now have to decide what do we want to do with that home. It was always intended to put it back on the market. There's been a lot of discussion. One of the things that has happened over the past 2 years is that there's been a mold problem. The house has been empty, except for some light storage, and there's no air conditioning in that house, so some of the dampness created some mold. There's a little bit of overgrown weeds in the back. I provided pictures to the board of the current condition. And I put in the memo, I guess we have some options, and actually there's a lot of options, and I wanted to know how the board wanted to proceed before we expended any township resources or energies on this property or did anything else. So with that, I guess, I know I've had some discussions with a couple of you individually. One of the options is to keep the property and use it as a staging ground. I'd be honest, I'm not particularly in favor of that. It was a discussion internally whether we could use that as an empty lot or not. I personally, but I'm willing to entertain any reason from anything on the board members, I'd personally like to put it back on the market in one way, shape, or form. I know that Mr. Van Tiffelen and Mr. Johnson and I discussed if we do that, we would like permission to retain an easement on the front end of the property in case we need to do work on that pump station again in the future, which we can do. We can make that part of any motion. But I guess to me the big question is how do we go, if we're going to dispose of this house, how much work do we want to put into it? Do we want to remediate the mold and sell it? Do we want to do nothing and just put it on the market? I guess I'm looking for opinions, advice. What do people want to do? Go ahead.
Can I make a comment? Just in my experience, I think since we purchased the property, I think regardless of the condition it's in, the value of it has gone up, based on the area has gone up in value. So I think if it was in perfect condition, it would be worth more than what we paid for it.
Agreed.
I also don't think we need to be throwing more money at it in hopes to get a better return. I would say we put it on the market as is, and we put a threshold that we're not going any lower than this. We'll get whatever offers we get, but I would say put it at whatever the current market value would be had it been in great condition, and say it's not in great condition. The lowest offer we'll take is, whatever we decide, probably what we got into it. And I don't think we need to utilize a real estate office or anything like that. I think we can just put it out there, and market it even through Zillow or something like that. I don't think we need to throw more money at it.
Okay. I should want to mention one other thing. Township CFO, I had her contact the insurance company. We are insured on that house. It is speculative whether or not the mold problem would be covered. We won't know unless we go through the process, filing a claim and having an adjuster look at it, and they'll determine what the cause of the mold is. If they believe that we're not at fault, they will, in fact, pay for the remediation, I guess, subject to the deductible. But, so there's a potential of getting some insurance proceeds if we were to proceed with remediation.
Mr. Chair, if I may.
Yep.
I agree with Trustee Lucido. I feel like dealing with mold, you can open Pandora's box. You could think it's a small problem, and once you start getting into it, it becomes a very large problem and very expensive. I think that we utilized it for what we purchased it for. I don't think it would be in our best interest to put any money into it to try and improve upon it. So I do agree with Mr. Trustee Lucido's idealism of it, how we should go about
Okay?
property.
Anyone else?
Question. Do we need the room over there? It looks crowded to start with now.
I spoke with Paymar. They said they could perform the remainder of the work. If we were to sell that house, they don't need that space, so they could perform it without that house if we sold it.
So, in a course of 5 years, what would be the odds of having to put a generator there for maybe 2 days in a row because something failed?
Yeah, we'll have a generator on site, so that's all going to be on there. It's more of if there was a major issue that we would need to get in there for it, some sort of structural issue we need to repair. It would be a rare occurrence that would happen. But as Jim mentioned, we probably want to procure an easement on that just so we have the room if we needed their space, which would probably encompass some of the driveway in the front of their house and a little bit in the back, but it'd be rare.
Knowing pump stations like you know them, living next to one, are they loud? Are they clangy? Are they bangy? Because that's I would consider. Yeah, we're going to easily sell that house, but are we going to have headaches down the road with the new buyer? You know, accusing us of making too much noise, accusing us of, you know, our trucks being there all hours of the night. What kind of impact is that going to do on whoever buys that house?
Yeah, noise will be minimal because they're all submersible, 40 feet deep, so noise will be minimal. It might be more of odor depending on the way the wind's blowing that day. That could be a minor inconvenience. We obviously mitigate that as much as we can, but it's going to be a necessary evil with where that's stationed. But that'd be a minor. But that's not going to be like every day.
Okay.
Yeah.
Thank you.
I will just comment that the pump station was already there when that house was occupied, so.
That's true. Yes.
Then people live there.
Presumably that was factored into the property valuation when we had it done.
Our new one's a lot bigger though. Our new pump station's quite.
Yeah, the difference was the other station was 30 feet deep with a pump that pumped directly into there was no wet well. This one's a wet well, so it's got an open top with lids.
Right,
So there might be more odor escaping where the other one really wouldn't have had that. So obviously we monitor that. We make sure we have other stations with the township that have that. We make sure to monitor that, do our best to mitigate that.
If somebody did buy that, the first time they open their windows up, they wouldn't be calling us up and saying they got an order. You're saying
It
it's
hasn't
possible.
run. It hasn't run yet, so it's hard to say, but it's possible. It's possible.
Thank you.
Yep.
Thank you, Charlie.
Mr. Chairman, maybe
Yes.
I missed it. What's the appraised value of the property?
Well, we purchased it for $195. That was the appraised value 2 years ago. We have not had it reappraised. Because I didn't want to take any, it would cost money to get an appraisal. I didn't want to take any steps until I had board direction.
If I could, Zillow has it as their estimate at 275 right now. Now that would be with no damage or anything like that, and it depends on how much you trust Zillow's estimate, but they can be pretty close. So,
Yeah, Mr. Chairman, I think it shows, you say 195, the transfer before that was at 180, so there's a significant spread there of almost $100,000. For discussion purposes only, wouldn't it be prudent to get an assessment? I mean, I'm unaware what the cost is. Is it a couple $1,000s?
Probably. I did talk to, so I did a little due diligence on my own. I called some residential real estate brokers. asked their just general opinion, and actually the opinions differed depending on who I talked to. But one thing they all did tell me is that comps on a main road property like that are very, very difficult to rely on. So my assumption is that a property appraisal is also going to be a little less reliable than it would be on like a subdivision house or a commercial property. Just a challenge. There's not a lot of comps on a property like that.
Well, for my 2 cents, I'm in the tribe of the thought process of selling it and liquidating the asset.
Okay?
With or without previous remediation of the mold?
Without.
Okay? Charlie, do you have something else?
You're saying an as-is sale, like,
As is sale?
yeah. I'm on the same.
Sounds like
same line
everybody's moving in that direction.
as- I want to ask.
I'm sorry,
Kevin
Tim
one-
had
one
something to
time.
say. I don't know if we can let Tim weigh in.
I was just going to indicate that a residential appraisal of that nature, when we did the Ringoloff property, it's $500, $600. It was relatively
Wasn't that
inexpensive.
much?
It wasn't that much for
Commercial properties are a little more
residential.
expensive.
Commercials is much more.
Okay, thank you for the clarification.
Just one last question. Kevin, other than the mold, did we do any structural damage when we done all the digging by that house?
We did not.
So that's in good shape?
Yes.
Okay.
Yep.
I toured the house. It's a really well-built little house.
Yeah.
Other than the mold and it's got drywall damage and aesthetic stuff, it's a 1952 house, all brick. It's got a basement. It's got an outbuilding, attached garage. It would be a nice property for somebody once it's cleaned up.
So going back to Mr. Lucido there, so you're suggesting that we just put a sign out there for sale by owner, submit bids, or how would
I just think self-marketing myself.
Yeah.
Whatever we can utilize that the township has, whether it be.
We've sold residential properties using the purchasing team in the past.
okay.
Because we stand to lose 6% if we use a real estate
True.
agent. I don't think we need to get into that either, so.
You can always try it, and if it doesn't work.
So Peter had suggested a floor. Is there a floor number that we would like to put in?
You say that out loud.
What?
I'll suggest 195,000.
I think we can, yeah. I
So
mean, we're
for
gonna say it.
discussion purposes, what if the highest bid we get is 180,000? Do we decide to keep the home and move into it?
We
and
have to
what do we
bring,
do?
then we bring it back to the board and have them make a decision, but
Okay.
I think it would be if we get a number that's much below what we paid for the house, we may choose differently when it comes to remediating the mold.
I would just leave it open.
Your suggestion is leave it open?
Don't even put a floor, don't put anything on there. Just put it on the market, see what you get.
No, because we can always turn it down.
Correct.
We'd have to accept.
So we want to put it on the market and not, we don't want to do it as an auction, correct? We want to put it on the market.
Yeah, if you did an auction, you'd have to have a result.
So we would list it at,
We're not just taking the highest bidder, we're actually going to market it, which is not something we did before. I think the other ones we sold we did them like an auction. Highest bidder got it.
Get one more question for legal.
Yep.
Do we have to disclose the mold or just put it on the
Yes.
market as?
Yes, you're going to have to
Do that.
disclose it, absolutely.
I think we just did.
I understand that.
Oh, legally, that's a disclosure that any property owner would have to make.
Well, that's, yeah.
You're going to have to do it through your seller's disclosure, just like any other entity or person.
But
So we could do a for sale by owner. We can leave it open as long as we want. We can accept offers instead of bids. And we can see what comes in, and if we get something close and we don't think we're gonna get higher, I'll bring it back to the board for approval.
Is that your motion?
So I would like to make a motion to put the house up for sale in a buy owner format. Working with the purchasing team, and authorize the township supervisor to sign off on an easement as necessary and decided upon by the land development team.
Support.
Okay? Roger, are we gonna cue this one up? Or just do it, or do it all?
Electronic.
Okay. Any discussion on that motion? Motion by Supervisor Viviano, supported
Mr.
by
Chairman, real quick, what type of foundation does it have?
concrete.
Poured concrete?
Yes, poured concrete.
Is there signs of water, crack in the foundation?
I saw a very dry basement when I was down there, but don't take my word for it. I'm not an expert.
We'll let them, laissez-faire, market, hand of the market, tell us. Thank you, Mr. Chairman, that's all I have.
Thank you. So supported by Trustee Lucido to sell the house as I just mentioned in the motion. Members, please vote. I hope somebody wrote all that down because I don't remember it. Motion passes unanimously.
Nice house.
Okay. That's everything. So we're going to go on to public comment. So this is for non-agenda items or anything else. Anyone who wishes to make public comment may make their way to the microphone on the the right-hand side of the room.
Ron Papa, 50759 Russell. No stump speech tonight. Just wanted to let residents know that Macomb Township residents are invited to a special candidate forum designed to provide insights on the candidates vying for the positions of the Macomb Township Board of Trustees. In addition, candidates for the Macomb County Sheriff will also be in attendance. This exclusive event is intended only for Macomb Township residents, and it's Tuesday, July 30th from 6:30 to 9. Folks who haven't voted yet, I know there's absentee ballot and early voting starting, I think, this weekend, but it's going to be at Tina's Country House on 23 Mile and North Avenue. We're honored to announce that State Representative Joe Aragona is going to be our special guest facilitator for the evening. The forum is actually co-facilitated by Tom Sokol. I won't give out his information. If people are interested and they've got questions, they can go to the Macomb Township Voices site. But just wanted to encourage folks to get out there. You'll be able to submit questions, and they'll, on a card, and they'll be picked randomly. So if you get a chance, get out and meet the candidates. Okay? Thank you.
Thank you. I don't see anyone else. I'll take us to board comments. Trustee Lucido.
I just want to say congratulations to the new hires, Erica, Dakota, and Ron. Welcome aboard. Thank you.
Trustee Nevers.
I too would like to congratulate and welcome the promotions for Erica and for Dakota and for our new firefighter. I'm sure you're going to be doing another great job, and just stay safe.
Thank you, Trustee Nevers. Trustee Oliver.
Same thing. Ron, congratulations, welcome, and congrats to Erica and Dakota. The other thing I want to talk about, you're not getting away that easy, is Josh, thank you and your staff for the great job they did on them dumpsters. Oh, I mean the
donation bins
things, because they were an eyesore. So I got a lot of people complaining, and you took action, your staff and all the people involved, and I'm glad to see that we're doing it the way we're doing it now. So thank you again.
Thank you, Trustee Oliver.
That's it.
Right. Trustee Guzmano.
Thank you, Mr. Chairman. I want to congratulate the employees that were advanced. And I also want to make a comment. I've been a resident for 23 years in Macomb Township, and I'm really looking forward to the future that the township has under the current leadership. Even the election process itself is positive. I remember getting hit pieces in the mail whenever there was an election, and I thought it made qualified people not want to run for office because they didn't want to get in the mud. And so I look forward to a vigorous campaign and positive. When all's said and done, I think that we should move as a township unified and not at each other's throats to try to advance ourselves politically. I believe everyone on this board is, in fact, acting in the best interest of the township. And I found no evidence of any self-dealing whatsoever by any member of this board. Thank you, Mr. Chairman.
Thank you, Trustee Kuzmano. Treasurer Gillette.
Thank you, Mr. Chair. Of course, I'd like to extend my congratulations to Erica, Dakota, and Ron as well. Other than that, building department, planning department, land development department, the success with the clothing donation bin cleanup is very helpful to the community. So thank you. And other than that, I have nothing.
All right. Clerk Posey.
I too echo all the congratulations on the promotions, and Mr. Tremonti, your experience and knowledge will be a tremendous asset to the full-time fire department, so congratulations. This Saturday, early voting will begin for Macomb Township voters at the Rec Center from 9 a.m. to 5 p.m. and ends on Sunday, August 4th at 5 p.m. Currently, we have just about 9,500 ballots that have been sent to our residents but have not yet been returned to the clerk's office. So we ask that our residents return those by Dropbox or postage paid in the mail as soon as possible. Reminder that this is a straight party ballot. You must vote in one party section in the partisan contests. And to contact us with any questions or if we can assist you. If you have spoiled your ballot, which means you voted in both parties, you crossed over, you can bring your ballot with your ID to the clerk's office and we'll rectify that for you.
Thank you, Clerk Posey. Firefighter Tremonti, congratulations. Position was well earned and well deserved. Looking forward to having even more of your time as you serve with us in a full-time position. Congratulations to Erica and Dakota. Thank you to Colby Miller for taking the time to come out and give us an update. And I want to thank again Senator Kleinfeld. I guess the one sort of editorial comment I want to make on that is I think what she has done for us is a great example of what elected officials, regardless of party, should do once they are serving. They have a job to do. Partisanship might be good for the campaign trail, but it is not the job that we do. It's not what we do here. Up here, we manage the business of the township. And Senator Kleinfeld recognizes that her constituency extends to Macomb Township, which maybe she's not going to win an election, but she recognizes our needs and has done her earnest best to deliver for us. And I think that's what every elected official should always strive to do, is deliver for their constituency, regardless of politics. And I think that is a fine example of what she has done for us. And with that, is there a motion to adjourn?
Motion to adjourn at 8:18 p.m.
Support.
Any discussion? Motion by Treasurer Gillette, supported by Clerk Posey, to adjourn the meeting. Members, please vote. Motion carries. This meeting is adjourned.